Welcome to On the Line with TBR. I'm Dan Taneyev. I'm speaking today with Dr. Adrian Popp, the Chair of Infection Control at Huntington Hospital Northwell Health and Associate Professor of Medicine at Hofstra School of Medicine. Thank you, Dr. Popp, for taking the time to speak with us.
Thank you for having me today.
So to start with, I know we're looking for that magical 70% threshold for herd immunity. Do you have a sense of how close we are in Suffolk County to that number?
Well, we were hoping vaccination would start rolling out pretty fast, and actually that happened. And over the last several months, more and more people got vaccinated. Right now, it's open more or less, like just show up and you can get a vaccine. You don't even need an appointment anymore. So the number of people vaccinated in Suffolk County and is percentage-wise around 55% of eligible persons. They also extended with a new approval of the Pfizer vaccine for the younger population between 12 and 16, which opened also a whole slew of teenagers who can get vaccinated. And I can tell you from friends and families that I have, a lot of people are taking advantage of this to get their kids ready for the coming fall when school will start again. And then who knows what will happen with coronavirus.
What about the rate at which people are seeking the vaccines now? I know in the beginning there was a rush to get the vaccine. Is the pace of people coming in still at a relatively high rate? And if so, is there any projection in terms of timing for when we reach that 70% threshold?
Well, these are open questions. Obviously, most people who wanted to get vaccinated, and there were very anxious people who stayed in lines and so forth. And the rate of vaccinations was limited for quite a long period of time by the number of vaccines available to the public. However, right now we're at the stage where there's plenty of vaccine available and the number getting vaccinated is somewhat plateaued, and the rate per day is coming down a little bit. And I think that the most eager people who want to get vaccinated did. And now we're seeing the people who are actually still willing to get vaccinated and doing it. And also some of people who are actually on the fence, getting more information and speaking with other people who actually received the vaccine. And I think more and more people are getting confident that the vaccine is safe, is efficacious. And I hope that this trend will continue, and hopefully we're going to get to even higher percentage. Now, how high this percentage of vaccinated people will be in Suffolk County, it's very hard to say at this point. There's still quite a few groups of people who are very, how should I put it, anti-vaxxers and strongly opposed to getting the vaccine. I hope that we will be able to kind of chisel away some of these groups and vaccinate people who are on the fence. And slowly, as more of us are vaccinated, even the ones who did not receive the vaccine will feel confident that it's safe and it works. So it protects not only the community, but protects you as a person. And that's the most important thing.
What about the efforts at messaging that the vaccine, as you said, is safe and that people and is efficacious? I know that there are efforts by County Executive Steve Bellone and national efforts to try to share information that counters some of the conspiracy theories, some of the concerns that people have regarding challenges to the fertility of young girls. There are lots of various rumors swirling or concerns that may or may not be based in fact. There are also incentives that people are giving to get vaccines. If you get a vaccine, you can get a ticket to a sporting event. If you get a vaccine, you can get a beer or some alcoholic drink. How effective? What is the most effective way to counter some of the concerns people have? And is anybody measuring what's actually working in terms of overcoming the wall of doubt?
Yeah, so we actually do measure what are the most effective ways of convincing people and giving them uh, the best information. As you know, there is a lot of information out in the community on the social media, on Twitter, Facebook, and so forth. But all of that, or most of this information, is unverified. Anybody can actually open a Facebook account and just post whatever they like, verified or not verified. Our public officials who do speak for vaccinations and are getting implicated in the effort of this campaign, it's very welcomed as well. But as you know, a lot of people do trust government or do trust some of these higher authorities who try to influence our lives for good reason at times. But probably the most effective way to get the best information is just talk to your own doctor. A doctor that or healthcare professional that you may know for several years. You may have a trust established over a period of time, and just ask the nitty-gritty questions that each person may have a certain doubt regarding whatever concern they have read on the internet, for example, starting from the infertility in young women, then continuing with these unusual blood clots that have happened with and Johnson & Johnson and AstraZeneca. So there are a, very many questions that people have, and it varies from person to person depending on who everybody is. And the best information you can get is from your own doc, your own healthcare professional, to give you the real data, the scientific data, the data that we know that we have, and that shows the vaccine is actually efficacious, probably more efficacious than we actually thought initially, and it's actually quite safe. So it does work, and that's where one should get the information. And it's true, it takes a long time. It's kind of labor intensive. It's a conversation one has to have one-on-one with each person, but each person has specific concerns that have to be addressed one by one.
Yeah, I know you and I have spoken about this before, but some of the people who are resistant to the vaccine don't actually have a doctor or don't have a doctor that they trust. They don't have that relationship in the medical community. Is this somewhat of a wake-up call for the medical community that the communities, the sub-communities within the population of Long Island and indeed throughout the country need to have a better connection to their healthcare provider?
Well, this is a challenge, and not being part of not having a doctor, for example, or being a part of a community that's not that involved in what's going on overall. It's a challenge, and how do we approach these type of issues is trying to reach them in different ways. People do belong to other communities. For example, people go to church.
Right.
People can go to other gatherings and that they feel connected with. So it is also our job as healthcare professionals to reach out to church communities, for example, or other places where people meet, and make ourselves available. In other words, be there and answer questions, open-minded questions, and see what people's concerns are, and have them getting more comfortable that the vaccination is the right thing to do.
Right. What about schools in the fall? I know there are a lot of hope. There's a lot of hope that these schools will be able to open without masks, perhaps, and at full capacity. Is there any expectation or discussion about what the public school environment will look like in the coming fall?
Well, we're at the end of this school year, probably another week or two until the kids will have full vacation. And at this point, the rate of coronavirus in Suffolk County is very low, has been decreasing since March steadily, and it is almost to a minimum for even compared to last year. So the question is, what will happen down the road? What will happen in the fall? And we know that coronavirus has a propensity to be more active in cold environment. In other words, in the fall, in the winter, and in the spring. So the expectation to see a dip in the summer is there. So what will happen in the fall? It's very hard to predict because of the occurrence of these variants that are coming around from different parts of the world, and how this variants will penetrate inside the United States, and how what the preponderance of this will be in Suffolk County is unknown. So at this point, I think that we should be hopeful that hopefully the fall will look good as long as more and more people get vaccinated, and hopefully by September we will reach above 70%, then going back to school will be easier. And the other part of it is children 12 to 16 have the possibility to get vaccinated as well, and that part of the school population can be protected, immunized, so they also, the children, can feel more comfortable, and their parents obviously, that their kids are also protected going back to school.
What about back to work? A lot of offices now are discussing the possibility or planning for the likelihood of bringing people back into the work environment. If there are individuals who have not been vaccinated, um, what should a workplace's best policy be to protect them and their families? Is it likely that some workplaces might need to consider requiring even those people who have received vaccinations to wear masks if there are people in their environment, in their offices, who have not been vaccinated?
Yes, this is a very difficult question because offices vary in size, number of people, how many people are sitting in one room, and how close they are to each other. So one has to make a decision on a case-by-case basis. Ideally, everybody in the working in one office should be vaccinated, which means would mean that everybody is protected as best that one can. However, if you have only partially vaccination, and some people are not vaccinated, probably the best situation would be to require people to wear masks, specifically the people who are not vaccinated. So this would be policies that each business has to implement depending on the specifics of how that office is and how spaced employees can be. And it's a difficult situation requiring or mandating people to get vaccinated. There's a fine line between your personal liberties and these mandates and public policies. So I don't know how far we can push people to get vaccinated, sort of just presenting the data and convincing them that's the right thing to do.
And I know there's a lot of talk about a booster, when that might be necessary, especially given that there, as you described, there are so many variants out there, and there are probably variants that are developing right now that may be more evasive from the vaccinations. What is, I know, I also know that there's no specific time frame established by the CDC or anybody else yet in terms of when, after a second vaccination or after the only vaccination in the J&J case, a person might want to consider a booster. How will we know when it's time to consider getting a booster? Will we only know when people start getting sick who have been vaccinated? What's the trigger to alert the country to the need to consider boosters? And once that process starts, if everyone who's been vaccinated then feels the urgency to get a booster, will we then have the same kind of backlog that we did when people first started getting vaccinated?
Well, the need of the booster is being debated at this point because I have to say that the efficacy of the vaccine and the immunogenicity of the vaccine is probably, in my opinion, higher than at least what I expected to see. So people do get quite a good level of antibody protection that we can measure, that it is at significant levels for quite a longer period of time. We actively monitor, even in also in research setting, the level of antibodies from people who got vaccinated from the early stages in December of last year. And we do find that they do hold their antibody levels quite well. And the expectation is, at least in the research community, that this could last maybe even 2 years or so. We don't know that yet. It's just one has to give it time and really find out. So the timing of getting a booster will depend on this factor. And then secondly, will depend on the variants and how many other variants that may not be covered as well by the current vaccine will show up, and when, and then we'll need a booster based on that reason. Now, talking about the availability of the boosters, the technology is there, and one can change the little details of the virus, of the variant very fast. And drug companies can actually be able to produce in significant amounts enough vaccines. So when the booster would be required, they should be pretty much prepared to have sufficient vaccine to roll out the process quite fast.
Is there any concern that when a booster might be necessary, let's say that there are enough warning signs in a population in Suffolk County or in some other area, that the community that might get the booster wouldn't benefit from it the way they didn't from the vaccination for at least 2 weeks until after they get the booster? So is there some time lag between when all the red flags go up and the warning signs are going off, that indeed the population needs a booster, but that when you get a booster, you should probably quarantine for a week or 2 weeks, during which your immune system then incorporates the latest and best antibodies against the whatever variants or whatever strain your body may not be prepared to resist?
Well, this is a little bit more of a difficult question because obviously there's going to be an implementation lag from the moment the decision is made that a booster is necessary to the moment that enough vaccine is produced and subsequently enough vaccine is administered to people, and then yet another week or two until the vaccine actually takes hold on a particular person. It all depends on how fast the public authorities and the health authorities will act. There are people in the research community that do monitor these variants quite closely. Different university centers around the country and also state labs do screen for variants in different states, and anything that's found is being published and shared with colleagues in the infectious disease community. So the surveillance system is there. And if they see something that requires attention and the need of a booster, I'm sure that they should be able to act quite fast. Will we need to quarantine again? Will we need to wear masks again and so forth? That has to be determined at the time, depending on how fast a specific variant may actually occur and spread around.
So how much surveillance how much attention are you paying to the data that's coming in now? Are you still paying attention to it daily, weekly? And are you at a comfort level now with it, knowing that the numbers are low enough that you're kind of relaxed about watching it? And are you expecting that the vigilance with which you pay attention to all these details will increase as we approach the fall?
Well, I have to say one thing. I'm very happy that the number of people hospitalized with COVID viral syndrome is very, very low at this point. We have just a couple of patients in Huntington Hospital compared to the spikes we were having during the winter time. So yes, our comfort level has increased, but as an infectious disease specialist, I'm kind of paid to worry when there's nothing to worry about.
Right.
And I'm looking at things that can occur, and I'm reading literature and data that not only from the United States, but we're living in a connected world. And what happens in India, for example, may have implications down the road with what's going on in the United States as well. So we do keep an eye on variants being reported from India or from Vietnam and other places in the world, because they may turn out to be an issue in the United States as well. So I'm happy to say that the number of infections right now, COVID infection, is very low. However, we have to keep in mind that the pandemic is raging in other parts of the world, and it may turn out giving us more trouble in the future.
I'm going to take one quick step away from COVID, because we are talking about Long Island and because we are talking about the summer, and it's almost impossible to speak to an infectious disease expert in the Long Island community without mentioning tick-borne diseases, Lyme disease, and others. I want to take just 1 second to ask a question about your concerns heading into the summer. Have you already started to see an uptick in Rocky Mountain spotted fever and in Lyme disease, tick-borne diseases? And are there steps, even though people are exhausted from the pandemic and they're finally relieved maybe that they don't have to wear masks everywhere and they've gotten their vaccination, are there things people should still keep in mind, because these tick-borne illnesses are very real and very problematic and difficult? Are there things, is there messaging that people should keep in mind with regard to ticks as well?
Well, tick-related disease is an endemic issue in Long Island. It's been going on for years. True, in the last maybe 2 or 3 years, I have seen more tick-related diseases than before. And we're not talking only Lyme disease. It could be also Babesia or Ehrlichia or Rocky Mountain spotted fever, as you mentioned. Rocky Mountain spotted fever used to be very unusual in Long Island, and now we do see cases. I have already seen cases this year as well, meaning that ticks do show up once the weather gets a little bit warmer. So somewhere in the middle of April, as ticks go hunting and people go out, here you have the mix where the risk of getting exposed to a tick is there. But in some ways, it's something that we have to kind of do the normal thing, the preventative type of thing, the easy stuff. It's actually quite easy to get protected against tick-related diseases. And specifically when you go somewhere, let's just say walking or hiking in some woods or meadows that may have ticks that may be around there. What you do at the end of the day, when you come home and you get your shower, you just have to do a body check and help somebody else look at every single area of your body, and specifically in areas that you can't see well, in the back or in the back of your legs and so forth, because ticks are small and they can be missed. And if you find them, obviously you remove them. So if you are in the habit to do like a tick check, to call it that way, every day that you go somewhere that a possible exposure could have occurred, you should be safe. And honestly, you can avoid getting any of the tick-related illnesses as long as you're diligent enough to do this.
Are there, I know I said I would ask one quick question, but I'm going to ask a second one. Are there areas, you mentioned the back and the back of the legs, are there areas that you see more commonly where people get ticks, where they don't find it or feel it or see it, that as a part of the tick check, people should be especially vigilant about? I mean, we can see our own arms and we can see we can kind of look in the mirror, but are there areas that people should ask others who are doing tick checks for them to look carefully at, or are there areas that are, I mean, I know a tick could attach anywhere, but are there areas where people get ticks that you see more often that might even be overlooked as a part of that tick check?
Yeah, the tick can attach anywhere, and I've seen people getting ticks anywhere on the body, including in your hair, on your scalp. You can have it there as well. Usually places that are, let's just say, more hairy are probably less likely to be, the ticks are less likely to be seen. Just bear in mind, the tick is very, very small. It's as small as the tip of a pencil. and it's like a little black dot. It's really, really tiny. So sometimes you have to use a magnifying glass to really see it well. So you need to have somebody to check to help you check your body that has a good eyesight, or wearing glasses or whatnot, to really, really look carefully. It's not just like a quick look around and that's it. One has to really check every single part of the body very, very carefully. But there is no specific site that is more vulnerable. I've seen people getting ticks that were missed on their arm, and they just didn't see it because their eyesight is poor, for example. And I looked and I didn't see I had a tick on my forearm. Well, here you are, you had it. So, and sometimes you see it later on when they develop the rash, but a lot of times there is no rash, especially with babesia, and about 30% of cases of Lyme disease, people don't have a rash or don't see a rash. So the rash in itself is not 100%. You truly have to look for the ticks and make sure you don't get tick bites.
Okay. And now just two more quick questions, and then I'll let you go. The first one is this RNA technology that's a part of the Pfizer and Moderna vaccines is something that I know the infectious disease community is especially excited about. That there is this approach is not only showing promise with regard to this, but it also potentially could be used in connection with other diseases, other challenges, public health threats. Have you heard of any other diseases specifically where this RNA technology is advancing at a fairly rapid pace? And does this proof of concept now through the COVID vaccines hold out greater hope for the deployment of this a similar approach to these vaccination for other diseases?
Well, I wish I would take credit, or the infectious disease community would take credit for this technology, but we can't. Actually, this mRNA technology has been developed for about 10 years already and has been in use in oncology for treatment of different cancers. There are already some drugs and medications that are mRNA based, currently being used for specific type of cancers. This is sort of the fancy therapy for cancer, meaning everybody knows about treating cancer with radiation and chemotherapy. But over the last 10 years or so, we developed different avenues where we can get oral medications that are a type of chemotherapy, but in reality, it's not real chemotherapy. They're immune modulator or type of proteins or antibodies that do stimulate specific parts, specific type of immunity reactions against those cells, those cancer cells that need to be destroyed. So this technology has been around for some time. It's just it became more prime time with the COVID vaccination, and then the researcher applied the same technology to create a vaccine. So yes, these are the first vaccine based on this, but the technology has been there all along, and it happened so fast in COVID. The development of vaccine was actually historically very, very fast because the technology was already existent at the time when COVID hit.
Sure, that makes sense. And finally, on the personal front, I know people tend to follow role models of those who are most in the know. So presumably with the position that you're in, you have a good idea of what is safer, what is you can do to change your life. If your family has been vaccinated, how has your behavior changed in the last few weeks, or even as you plan for the summer and the fall? Are you comfortable getting on planes? Are you comfortable traveling internationally? Are you are there places you wouldn't go just because even though you've been vaccinated, the variants may be evasive to the vaccine or may be resistant or to the vaccine that you have? Or how has your life changed, and how are you planning for the next few weeks and few months?
So a lot of things that we do in life, honestly, have to be common sense. In other words, there are dangers around us all the time. the COVID variants is one thing, but that there's a lot of other things that can always go wrong. So specifically for coronavirus and this type of public threat, you have to use common sense. Let's just say you want to go to a restaurant and you kind of scout the restaurant and see how things are in there, how many people, how close the tables, how crowded it is, and so forth. And you can make a decision if that you feel comfortable being in that environment. And people have different level of, how should I call it, tolerance about these things. And some person may feel comfortable versus some other person may not. So if you go there with some friends or family, you have to be respectful for the other person's type of anxiety, let's call it that way, and comfort level, and discuss it beforehand. Okay, let's go to restaurant Y is on the water, it's outside, and you don't know who else will be around there. I know you're vaccinated. I think that most people will be comfortable going there, and it's okay. Taking a plane flight, in some ways, is the same thing. Everybody on planes still has to wear a mask, and I think that's probably the right thing to do. Now, if it's a 2 or 3 hour or even longer going to California plane flight, I think it's probably okay to do that as well. The chance of getting exposed is very low, especially with the prevalence right now being as is. So I think one can fly, one can take a vacation, and be comfortable about it. Even let's just say going to different hotels, for example, that would be fine. Going overseas, that's a more tricky question. I probably wouldn't travel to India right now. I think most people may agree with that, but for example, Europe is opening up and their rates are coming down, so probably visiting there will be okay, but it's probably a little bit early at this point. So I would stick with traveling inside the United States.
What about something like a wedding? I mean, I know there are a lot of people who are engaged who have been desperately eager to get a wedding they've now maybe postponed once, twice, three times, and they have a vision for what their wedding should be like. If you were invited to a wedding today, would you start asking questions about how many people are going to be at the wedding, what the venue will look like, how spread out it is? How would you, A, if you're trying to plan a wedding, how would you plan a wedding? And B, if you're invited to a wedding, what kinds of questions would you need to ask to be comfortable attending a wedding?
Yes, the wedding situation is quite a big situation because weddings have been postponed. There's a lot of people who postpone their weddings in the hope that they can have a real thing later on. And I have been invited to weddings. Friends of mine have been invited to weddings, and the approach people have taken varied from A to Z. In other words, there's no cookie cutter way to say this is the right thing to do and that's a wrong thing to do. I have a friend of mine who is getting married, who is actually asking every single person to be vaccinated. If you're not vaccinated, you're not allowed in the wedding. And this is the decision of the groom and bride, basically. So here you are versus other venues are obviously more open, and they invite everybody and so forth. As a person, uh, let's just say, putting me on the spot, if I get invited to a specific wedding, would I go? Well, again, common sense. You look at, I would at least personally look at what's going on in terms of how many people are invited, how the venue looks like, is it indoors, is it outdoors, and some of these details are important. And you can also get a sense from who gets invited, kind of how many people are truly vaccinated in that crowd that you're going to mix up with. So it's not a yes or no answer. And in some ways you can go and think you're comfortable, and you arrive there and you may find out there's certain things that you don't like and you're nervous about certain aspects of how the wedding is being organized. In some ways, you don't have to stay, meaning in the end you have to be comfortable with the decision you make, and you're going there to have fun, so you can have fun and celebrate if you're nervous.
Right. All right. And one final question. If is there are there any other possible game changing scenarios vaccines, anything on the horizon that you see that will change the dialogue, or for the better or for the worse, in terms of COVID? Are there elements at any of the pharmaceutical companies, anything that you're hearing about, seeing, reading, that you think, okay, well, much as things are the way they are and people expect them to be this way now, a month, 2 months, 3 months down the road, if this plays out the way I'm hearing, um, you know, COVID will be either a thing of the past or will be back taking center stage. Is there anything that you see on either side of the ledger being a game changer?
Well, I have to say that I'm happy to see that the number of COVID cases has decreased significantly, and that a big role in this is people getting vaccinated, and more people will get vaccinated. And as the cold season will come later on, I hope we'll have an enough threshold to take a huge dent on the number of disease and the COVID cases that will happen in the coming season. That being said, I'm not that convinced that we'll reach what we call herd immunity completely. I'm sure there are going to be pockets, Suffolk County included, certain areas where people are more reluctant to get vaccinated, and I'm sure that we're going to still see COVID down the road. And the likelihood is those cases will most come from specifically the areas that were reluctant to get vaccinated. That's one aspect. The second aspect, we do live in in the world where we're not disconnected to the bigger world in itself. So what happens in India, or what happened in South Africa, or what happened in Vietnam will eventually have implications with what might be going on here in Suffolk County. So we have to keep our eyes open with that, new variants and so forth. In some ways, getting people vaccinated in India could be in our interest, or strategic American interest, because it's less variants that could come out that later on can haunt us here. So it's a bigger picture, and how this will play out over the next several months, couple of years, we'll have to live and see.
Yeah, fair enough. All right, I will leave it at that. Thank you very much for the time. I've been speaking with Dr. Adrian Popp, Chair of Infection Control at Huntington Hospital and Northwell Health, and Associate Professor of Medicine at Hospital School of Medicine. I look forward to speaking to you again and appreciate your time.
Thank you for having me.